Next, I'd like to welcome to the podium for his 9th presidential address, Dr. Darrell G. Kirch. Darrell assumed the presidency of the AAMC on July 1st, 2006, after serving as Dean and Academic Health System Leader of 2 institutions, the Medical College of Georgia and the Penn State Milton S. Hershey Medical Center. Darrell speaks and publishes widely on the need for transformation in our healthcare system and the many ways in which academic medicine can lead change in medical education, research, and patient care. Since arriving at the AAMC, Darrell has guided efforts to recruit a new leadership team, strengthen the association's governance structure, and develop and refresh a strategic plan that focuses the AAMC and its members on a common mission of improving health for all Americans. He has also enhanced the association's role in Washington as a trusted source of data and policy advice, and oversaw the construction of a new association headquarters and spectacular member learning center, which opened this past June. I encourage you to attend one of the town meetings that Darrell will be holding later in this meeting. They're scheduled on Sunday and Tuesday morning from 9:30 to 10:30, which you'll have an opportunity to participate with Darrell in an open Q&A. Darrell's talk today is entitled Resilience. Please help me welcome Dr. Darrell Kirch.
Peter was very kind with that introduction, but he was especially kind given that he has a bit of a day job leading Mass General. He was especially kind to volunteer to lead our board this last year. And I also want to thank Loris Betts, not only for his agreeing to lead the board this coming year, but for an incredible talk. You know, it was 7 years ago, it's hard for me to believe, but we were at an annual meeting we had in Washington, and I gave a talk entitled Culture and the Courage to Change. But it was really easy for me to give a theoretical talk. What Loris just showed us is how he and his colleagues at the University of Utah were able to put that into action and actually change the culture of their institution. I was privileged to visit there last year, and just walking the halls, I saw firsthand the impact of what they had done by creating not just this emphasis on an exceptional patient experience, but it also was creating the kind of positive learning environment we've all been talking about this year and at this meeting. And then I need to thank 3,800 of you. We've really been gratified. We're sorry about the space constraints, but really have been gratified by the enthusiasm and energy that people have brought to this meeting. You know, but even beyond feeling this great sense of community that I always get at the meeting, I also have the privilege the entire year round to visit your schools, your hospitals. You invite me to speak at our member professional societies. And those are the times when I get to see, up close and personal, just the incredible work you're doing. So just since we were in Philadelphia last year, I've had a chance to make 60 of these visits to your campuses, to your organizations. I am inspired by what I see, but part of what I want to talk today is that I also, especially in the last year, I feel I've increasingly been hearing deep, deep concerns. And I've been hearing them loud and clear. So typically, if I get invited to give a talk, we have a Q&A afterward, and you do not hold back. You ask these very pointed questions about our current and future prospects in academic medicine. So I'll tell you the questions I hear, and you tell me if you don't hear these virtually every week or every day on your campus. So somebody will say, NIH funding is flat. I think we're going to lose a whole generation of new scientists. And then the next person will say, wait, it's not just NIH funding, all our revenue streams seem to be crunched and constrained. Do we even have a viable business model anymore? And then the next person gets up and says, well, you know, speaking of business, we're out here forming all these new partnerships. Does that mean we're just abandoning the academic mission? And then the next faculty member gets up and says, yeah, and about those partnerships, you know, those community hospitals have doctors. Are they faculty the way I consider myself to be a faculty member? And if you think those are tough questions, then the students get up. Their questions almost always start with, my tuition is so high, am I ever going to be able to pay off my debt? And then everybody in this room knows the last 2 years, a new tough question that's been added is the student says, you know, with the competition for residency slots being where it is, what am I going to do if I don't get a residency position? And then what's really painful, I know, for all of us because of what we believe about academic medicine is the student who says, I've talked about debt, we're talking about residency careers. Can I even consider an academic career, or is that just a pipe dream now for me? So in recent months, really over the last year, I've been thinking about these things less and less as the dean I was or as AAMC president. And I've found myself actually thinking about them more as the psychiatrist I trained to be. Because I have to wonder if our concerns are running so deep, what's the impact of this on our overall well-being? What kind of toll is this taking with us? And I'm not the only one who says it, because in all these visits, it's amazing to me how often issues of stress and burnout come up. So that then led me to go back and say, well, we believe in evidence. What's the evidence? Well, the evidence is chilling. There was a 2012 paper published in JAMA. It came from Tate Shannonfelt and colleagues at Mayo. They surveyed 7,000 physicians. And in the survey, they had a number of questions they asked. And the bottom line result was that nearly half, 46% of physicians reported at least one symptom of burnout. And then what concerned me just as much was that some of the burnout was on the front lines of patient care most intensely. ER docs were the highest. Emergency medicine had a 60% rate. And then I read on to discover that 40% of these 7,000 physicians screened positive for symptoms of depression. And then, most chilling, 7% of the respondents reported having suicidal ideation in the last year. So that's the literature. Sometimes we can detach ourselves from that, but then I think I'm probably like many of you, I think it was early this fall, saw an opinion piece that was written in the New York Times by a first-year resident from Yale named Pranay Sinha. The essay was entitled, "Why Do Doctors Commit Suicide?" And it followed on something so many of us heard about, which was the suicide of 2 residents in New York in close proximity. And the article, you know, Alan Alda told us this morning about the power of stories. The article was really this resident's story of going from the exhilaration of graduation to the pressures, not just the burnout and the depression, but this burden of isolation and this feeling of intense expectation for perfection that resident and so many doctors feel. You know, I think a lot of people in this room would say that medicine, on the one hand, is the most gratifying, stimulating, noble career a person can pursue. but we're sitting here today, I think, with a lot of our colleagues in genuine distress. So if we let ourselves talk about it, what is causing this? I think we almost always say it's all these changes in healthcare. If they would just slow down or even preferably stop for a while, maybe we could get ahead. Maybe we could feel better. So what about change in healthcare? So recently I was reading an AAMC report about the stresses on academic medicine and healthcare. And it describes struggles to keep pace with change. And I pulled out a few of the quotes from the report that I want you to read. So one of the first observations the report made, if I could have that first slide, sounds very familiar. More health care will be demanded. More physicians need to be trained immediately. The next one is, we've had this clear trend, and a trend that's virtually certain to continue, are rising healthcare costs. How familiar of that is that? As well as the cost of educating physicians has grown. And then next, we have this relentless rise in specialization. That means we need to form teams and have team-based practice where everybody contributes. And then this one, the science just keeps getting ahead of us. How are we ever going to keep track with that? Well, isn't that exactly what we're all hearing? Doesn't that sound familiar? So guess what the report was? I have a copy of it here, this aging yellow document. It was dated 1965. And it is what, for some people, is the well-known Coggeshall report. Lowell Coggeshall was here in Chicago as the dean of the University of Chicago Law School, or Medical School. Sorry, Lowell. Didn't mean to do that to you. He was a wonderful leader for academic medicine. And his report was really influential in shaping what we've done in the following decades. In fact, it was that report, the Coggeshall report, that took the AAMC from being a very small organization in Evanston, Illinois, a club for deans where an annual meeting would draw maybe 75 people, to being the organization it is today. So Lowell Coggeshall, 50 years ago, was seeing these same problems of healthcare cost, the rise in specialization and what it meant, the need for teams. And I'm sure there are lots of people, perhaps somewhat cynical, who would say, well, that proves it. We haven't made a bit of progress in 50 years because we seem to be fighting exactly the same battles all over again. But I'd offer you an alternate hypothesis about this. I don't think we're fighting the same battles, because I can see, and you can see even more closely from your front row seats at your institutions, you can see more clearly all the progress we've made over the last 50 years. So what I think is the reality here is that we are in a constant state of uncertainty. The challenges will always evolve for us, and then committed generations of academic physicians will make steady progress addressing them. And if you look at the evidence, every time our nation faces a massive challenge, you're the ones who step up. So we don't have to do anything other than look at the recent news. There's an epidemic of fear about Ebola in America. Right? Fortunately, it's been less of an infectious epidemic than an epidemic of fear. Everybody's worried about it. Everybody was worried about the lethality of the disease, and yet our colleagues, University of Nebraska Medical Center, Emory, our colleagues at Bellevue, our intramural colleagues at the clinical center in NIH and Bethesda, have shown this can be treated successfully. And is it any different? Remember, some of you aren't my age, but for those of us who are, remember what it was like when the AIDS epidemic first started? And we all believed that every hospital bed in America would need to be dedicated to the care of AIDS patients. That didn't happen because of what we did in science and clinical care, the way we stepped up to the challenge. So the uncertainty, the challenges remain, and each time we step up and respond. So that took me to wondering about the next thing, which is, how can we do that? What is it that drives us forward? What in the world inspires us to keep taking on these unending challenges and keep trying, even in the face of doubts and outright failure sometimes? So my theory is, the reason we've been able to do this is I think there's a quality that is shared not just by physicians, but by virtually every person who goes into healthcare, everyone who comes to work at an academic medical center. I think it's a quality that enables a person to work on a problem that may actually take decades to resolve. And I think that quality is resilience. So there's a Harvard professor, Rosabeth Kanter, and she has a great description of resilience. I'll read this one verbatim. Resilience draws from strength of character, from a core set of values that motivate efforts to overcome the setback and resume walking the path to success. Resilience also thrives on a sense of community, the desire to pick oneself up because of an obligation to others and because of support from others who want the same thing. To me, that sounds like a medical school or a teaching hospital. The obligation is the Hippocratic Oath, and the community of support is all our colleagues in the institution. You know, think about it. Isn't resilience one of the things you screen for when you're interviewing an applicant to medical school or residency? Isn't it something that when we see a colleague demonstrate it, we really admire that? You know, even if there isn't some kind of traumatic stress we're facing, we have colleagues who show optimism. They show self-confidence. They're actually willing to embrace change, the way Loris's colleagues were. And then when times get tough, we show our courage. You know, think about your own career path. Did you get where you are today with absolutely no setbacks? Think about your last month or year, the unmatched student you were so disappointed about, the failed experiment that imperiled your next grant application. Think about the death of a patient that in hindsight you find yourself thinking, maybe I could have done something differently. We face failure all the time, but I would argue that you have pushed to where you are today because you have resilience. I would argue that there's resilience that we show as individuals, there's resilience we show as institutions, and there's resilience that we show as a community of academic medicine that has made all of this possible decade after decade, despite the challenges Dr. Coggeshall saw 50 years ago and that we're dealing with the next iteration of. We can see their deep concerns, but we can map out all their successes that followed on those concerns. So I'm so privileged that you give me the honor of working in this position, because what it is a chance to, time after time, visit your institutions, talk to you, and to actually see your resilience at work. So I think it was late summer in August, I visited the University of Alabama, Birmingham. You know, that's a research-intensive institution. But even though NIH funding is at historically low acceptance rates, people are persevering. So there's a physician scientist at UAB, Dr. Talene Yakubian, and she studies Parkinson's disease. She's a neurologist. Parkinson's disease, as we all know, is not only a tough disorder, but it's a disorder that actually is projected to double in prevalence by 2040. So Dr. Yakubian, brilliant young woman, was denied R01 funding 3 times in a row. I asked her, I said, how did you persevere? How did you continue in the face of that? And she said, my chair was supportive, my department was supportive, community, and she said, when I saw my patients in clinic and the burden that they had, it pushed me forward. Her community supported her, and she had that sense of obligation to those patients. You'll be glad to know she took a new direction, same disease, new direction, and her 4th R01 proposal was funded this spring. Now that's resilience. So let's elevate it up to the level of the institution. Many of you know Jeff Balzer, the head of Vanderbilt Medical Center. It may have been over a year ago, possibly longer. Jeff called me one day and he said, I want to give you a heads up, which always gets my heart rate up a bit, but the heads up was about something happening to him. He said, we just ran the numbers, and basically we're convinced that by the end of fiscal year 2015, we're going to have about a $250 million deficit. And he said, we're going to have to make some tough choices, and I think you may be hearing about it. And I thought, this is a very difficult situation, but I also thought if anybody can show some resilience, Jeff is the person and his colleagues. And they did the usual things you would think about. They reduced their operating cost, but they also decided that they would make new connections, form a broader community. So they forged some new clinical partnerships that would strengthen their system, as well as the ties that they had to their community. And when I recently called Jeff, just so I would have follow-up, and he said they're in a much, much stronger financial position, hitting all their targets. But what he wanted to talk about was the fact that the shared experience of doing that actually brought people at Vanderbilt closer together, because they communicated broadly and repeatedly. They built on their sense of shared purpose and their obligation to their faculty, their staff, their patients, to their region. That's resilience. I don't think there's any better sign of our shared commitment to resilience than the cards that were on your chairs when you sat down. You know, it's a simple, 4-paragraph statement. But if we can take this statement from words on a page to the kind of culture where we really do promote dignity, respect all round, it's actually embedded in the statement. It will also foster resilience. Another example that I have just seen over the last 2 days of resilience at work was the first National Medical Education meeting the AAMC had sponsored. Other than these gatherings, this was the largest single meeting the AAMC has ever held, over 1,100 people. And as I walked the poster sessions and as I listened to the hallway conversations, sat in the abstract presentations, it was all about innovation, and the energy was palpable. There was a community of educators with the goal of training their students better because they wanted to improve the health of the population. So I've just given you evidence I'm privileged to see when I travel, of individuals, institutions, parts of our community showing resilience. But let's circle back, because you must have the same question that I found myself thinking about. If that's true, why are these rates of burnout, signs of depression running so high? Why are we having tragic, tragic suicides of colleagues? I don't think that the resilience you had to have to get through school, to move your career to the point it's at today, I cannot believe that we've all suddenly lost that. What I do think has happened to some of us is the press of things upon us has dimmed that sense of shared commitment to our mission, and that at the same time, we become isolated. And when we're isolated and alone, we don't have the networks of support. We actually, many of you participated in Faculty Forward, the initiative to collect data on faculty satisfaction. And when I went back and looked at those data, it's interesting that 2 of the most significant drivers of faculty satisfaction are connection to institutional mission and interaction with colleagues. I have come to the conclusion that, unfortunately, there is this very short path to burnout and depression if we allow ourselves to lose that connection to mission and connection to colleagues. That's the fundamental danger we're all facing now. I know everybody in this room feels challenged. I feel challenged. That's why it's so important to come together here once a year, but that's not going to be enough. I think we really need to commit throughout the year to start really working harder to draw strength from each other, to talk more about what brought us here in the first place, what we aspire to do with our careers and our lives. You know, we have evidence that collectively, time after time, over many decades, we've risen above all these obstacles. We've fulfilled our shared commitment to educate doctors, to discover cures, to provide our patients with the best care we know how to give. We've shown our resilience in the past. How do we do it going forward? Marty Seligman wrote a wonderful book called Flourish. I like the title. He captures it this way. Resilience is the glue that holds groups together, provides a purpose larger than the solitary self, and allows entire groups to rise in the face of challenges. So let's try this. As you leave here today, and in the days to come, let's ask ourselves some key questions. Have the people I work with somehow lost this connection to our mission? Does it still inspire us? Or have we lost sight of it because we've just become so focused on the daily problem at hand? Ask ourselves, are we talking honestly with each other about the stresses we feel? If you go back to that essay by Pranay Sinha in the New York Times, the thing that helped him most was sitting down over lunch and finally admitting to a colleague how burned out he felt. And he said that was the turning point for him. Are we talking with each other, or are we letting ourselves get isolated in the fog of daily demands? And if we've lost the connection, if we don't see that mission so clearly, or if we feel isolated, let's take some action. Let's mobilize ourselves and some of the people we feel we trust the most. And let's try to fire up again our sense of shared purpose and admit that we want to support each other. I think over the years, academic medicine and its people have epitomized resilience. And you've given me a chance over the last 8 years to see it at work, admiring your accomplishments in the face of challenge after challenge. I am more convinced than ever that today we have the ability to tap into the core resilience that got us all where we are today and meet the challenges ahead. I also know our nation needs us more than ever to do this. Thank you so much.